Welcome to the Friendly Moms Club podcast with Jen and Karlee. We're the new mom friends you didn't know you needed.
We are creating a safe space to bring moms together, lighten the heaviness, and find joy in the everyday moments. Together, we will share our own experiences of being new moms while navigating the topics we wish more people talked about.
Join us every Monday to hear us skip the small talk and dive right into the uncomfortable.
We are so excited for you guys to be here today. We have Meagan and Alyssa from Bump Physio here. So hi, welcome.
Welcome.
Hi guys, we're really happy to be here. Thanks for having us on the podcast.
We're excited to have you.
Yeah.
So why don't you guys tell us a little bit about yourselves? Maybe Meagan, you go first, just kind of what you do, what's your jam, who you are.
Yeah, so I'm Meagan. I work at Bump. We have 2 locations. I'm working at the Port Moody location and Langley one. I'm a pelvic health physio with, I guess my practice is mainly focused with pelvic conditions, but I also really like treating regular kind of MSK or orthopedic conditions too. I'm a competitive Olympic style weightlifter, and instead of physio, that's what I do. And I also like to incorporate that into my practice where I love working with athletes, like whether it's in my sport or whether it's CrossFit or any type of sport or kind of gym activity people are trying to do. And I love kind of combining the pelvic health, so people who are struggling with maybe incontinence or things of that sort, with kind of the sport aspect. That's my passion in my practice, I guess.
Perfect.
That definitely comes into play because, like a quick aside here, that now every time I go to the gym to work out and I see a trainer once a week, and every time I go, I have to pee right before that we do the workout. And I never used to even think about it. Like I could just go to the gym and work out. And now it's like I have to go to the gym, fill up my water bottle, and go to the bathroom and then work out. Like it's another added step now, just because of my pelvic floor health that I'm working on. So anyways, Alyssa, if you want to introduce yourself.
Yeah, my name's Alyssa. Thanks so much for having me on your show today. I'm also a pelvic health physio at Bump. I work specifically at the Port Moody location, and Meagan, general physio by trade. So I really enjoy treating people with all types of concerns, not only pelvic health ones. And you can't really address the pelvic floor without looking at the whole person. In my practice, my physio practice also is in the public sector too. So I work at a hospital in a very different area, but I really like the variety. Keeps me passionate about what I do, is just helping people get back to doing things that they love. Function is really my foundation of my practice, that really, if you can be functional and do something you like to do, and I can support you to have your body help you get back to doing what you like to do easier, that's something that really makes me happy too.
Perfect. I love that.
That's awesome. Yeah.
And you know what I think, something I noticed, that both of you have called it pelvic health instead of just pelvic floor. Is this like a new shift in the approach, or is that kind of what it's always been called for you? Because in my head, I think pelvic floor therapy, but is that something that you guys always call it, pelvic health instead of pelvic floor? Or is that just me noticing something random?
No, I would say I definitely try to make an effort to address it as pelvic health, because like I was saying, there is a lot more that goes into function, or on the other side, dysfunction, that goes much beyond just the pelvic floor muscles in themselves. So I think it really is just a more holistic term. And coming back even from the terminology standpoint, previously this area of practice was almost solely called women's health. Even now there's been a big shift to just inclusive in language, and really just to things as pelvic health. Not only is it people with vaginas or assigned female at birth that services or support with their pelvis, but also assigned males at birth, and also people with other different gender identities as well.
Yeah, I love that. Good shift.
It's interesting because, so I have a pelvic floor dysfunction and vaginismus, and I get like spasms basically, and my pelvic floor muscles are just spasmed all the time. And I've been working with a pelvic floor therapist or pelvic health specialist. I'm going to screw this up, but I'm going to work on it.
Yeah, pelvic health
pelvic
therapist.
health therapist. But it's interesting because some of the exercises we do, I don't just go there and do Kegels. I'm doing all these other exercises and doing like cat-cow, thank you. Yeah. But then I'm using these balls and doing these things with my hips and my legs and circles, and I'm like, so how is this going to help?
Squeezing your vagina.
But then I stand up after and I'm like, oh, I do feel better. Everything feels more relaxed. And so it's helping my pelvic floor, but I'm not actually moving or like doing something specifically with my pelvic floor. So it's interesting that you say that, because that's been my experience. There's lots of other things that you can work on, and then it will help.
Everything. Yeah. Your pelvic health.
Yes.
Yeah. Yeah, you got there.
You nailed it. That's exactly
Go
it.
Jen.
Yeah,
You
love
could be
that. Love that.
Last night I had, basically it's like a calf cramp, but I get it in my vagina, and it is really annoying, and I got it last night in the middle of the night, so
Yeah, it sounds
I have to get out of
uncomfortable.
bed and go grab these 2 balls and lay on them and do these things, but it actually helps, and it takes me 5 minutes, but then I can go to sleep and I don't have a cramp in my vagina anymore. So it's
That's
great.
goals. That's
it's a win.
goals.
I know.
That's
it's
goals.
good.
Yay, we
So,
love vaginas with no cramps.
Right?
Yeah, right?
I know.
No one wants that.
Cramp-free vaginas.
Yeah.
Can you guys tell us a little bit about what brings people to pelvic health therapy? Like, what kind of clients do you see? What are they usually seeking when they come see you?
The majority of our clientele oftentimes are like our pre-postnatal clients.
Yeah.
People hoping to just kind of get some maintenance in pregnancy, make them feel good for labor delivery, whether it's that vaginal or whether it's a C-section. And then individuals coming postpartum, kind of what Alyssa talked about already, but getting back to function, getting back to feeling good in your body, or getting back to some sort of specific sport or activity. We also treat your regular orthopedic conditions, so people with maybe a sprained ankle or a frozen shoulder or things of that sort. Lots of people coming in for like perimenopausal. We got people coming in like post-op, maybe hysterectomy. We also
One thing to add, also pre-op hysterectomy. It's always nice to hit things preventatively and prehab for upcoming things that you know are upcoming.
Yeah. I love that. So it's kind of like the whole, like you said, holistic approach. Before, like, you don't have to have a problem or an issue to go. You can also just go as part of your general health, right? And I believe in Europe, aren't there countries that like pelvic health is just part of like regular healthcare?
Yes. Australia is ahead of us for sure. The pelvic health world in Australia, perinatal care is just standard of care. Whereas here, it is more difficult to access services that you might need versus other countries where it's more sort of already normalized and already just part of the course rather than being like surprised that.
For sure.
Yeah, it almost seems like it should be normalized to be part of the, whether you're trying to conceive or you're pregnant.
Or even just general health,
Yeah, but like this is just a normal thing that you go see a I cannot speak today. Pelvic health specialist. No, I just can't say pelvic.
It's hard. It's a big word.
Anyways, that should just be normalized that you go to these appointments and that you don't have to have this problem. And then same with you're trying to conceive. A lot of people go and do blood work. Why don't you go and just check things out, see how things are going? And same with when you're pregnant. Everyone should just be going. And
and to kind of add on that, what you just said there is I would love to see a shift in whether you're, like you said, trying to get pregnant or whether you're pregnant, I'd love to see those primary health practitioners like, your OB, your doctor, whatnot, to just promote, hey, you're pregnant. It would be a great idea to then also go to pelvic physio or postpartum after vasection. Be like a normalized thing to be like, okay, in your recovery, you should go do pelvic physio, because oftentimes people who have like back surgeries or other type of surgeries, they have such a comprehensive rehab plan for them. I should see the same thing for people who have some sort of pelvic surgery or delivery or C-section.
Because it's a lot happens down there when you have a baby.
And regardless how that baby comes out.
Regardless, as Karlee says, it's vaginal or by the sunroof, and like it doesn't matter. A lot happens, right?
Never heard that.
The sunroof.
Leave it to the labor and delivery nurse. The sunroof. I laughed very hard when she told me that the first time. It's a huge body shift. It's normal for things to feel different afterwards. So why wouldn't we be going to just get it checked and see how it's functioning? And for me, I had a lot of these problems before I even thought about having kids. So I had gone and I've had exams done and seen a pelvic health specialist several times. And so I really wanted to go after having a baby because I wanted to see how it felt. Like I went fairly soon after giving birth to my second child because I just wanted to get like an assessment and see where I was at and see where it was compared to before I had kids and see what was different. And because I had the previous knowledge, we knew what was kind of going on and what to look for and what was different. Whereas if you've never gone before, you don't know what's really different. Like you might be able to do an assessment and see things that maybe aren't functioning as well, but you won't know what's changed necessarily, right?
You don't have a baseline.
I love that. And oftentimes when I see individuals postpartum, I'm like, do you know what was happening before? Do you know what things looked like in your vulva or your vagina? And that's not on them. Maybe that's on lack of education from healthcare or whatnot. But I encourage individuals to know what your anatomy looks like. And it's maybe a daunting task, but take that mirror, take a look at your vulva, kind of get to, so that just like yourself after childbirth or whatnot, you can kind of have that comparison point.
For sure. And I feel like during childbirth, not even during childbirth, during pregnancy, postpartum, it's like the only time it's like sort of normalized to get to know your body. And then otherwise, it's kind of a stigma for women and girls to explore their body and to know what's going on. And that's a much deeper issue than what we have time for today. But can you share with us a little bit of like the misconceptions about pelvic health, or even misconceptions about seeing a pelvic health therapist?
Yeah, definitely. I feel like a lot of it
that's all we
comes
got for
to
today.
what
Tune in to next episode to hear the rest
understanding
of this
what's
episode
maybe
from
common,
the Bump
but not
Health
that's normal.
Therapist
And a lot
Alyssa
of
and
things are
Meagan.
normalized in
Bye now.
our society that aren't actually normal.
Yeah.
For example, having pain with sex isn't normal. It's common and it happens. And there's a lot of people who think like, oh, if I have more sex, it'll just go away. Or, oh, this is just what happens for everybody, when that's not necessarily true. And actually, sex should be pleasurable, not painful or causing discomfort. So this can also come back to just understanding of the female body and like what is pleasure and what does sex look like for a woman or female, or for somebody who might have pain with what you might think of sex as, like very like penis and vagina, but that's not necessarily what sex is for everybody.
Sure.
So those are just important things to talk about, and just understand that it's not normal, and there can definitely be support for some of those symptoms. I feel like another one is that, peeing yourself as you get older after you've had a baby is normal. It's just what happens after you've had a baby. And it's common because, yes, there's been some level of trauma to the pelvic floor muscles. It's similar if somebody were to be training for a marathon and strain a calf muscle, it needs some level of rehab to strengthen and repair, because there's been some type of event, a birth, a delivery that's put demands that are very high on this group of muscles and the whole body. So it's common, but not normal. It actually is a sign of dysfunction, but having that knowledge also means that things can be improved. Those muscles can be rehabbed, and their function can definitely improve. It doesn't have to be just something that you live with for the rest of your life. Or it also isn't just necessarily going to be something that just goes away on its own.
I love the approach of like, it's something I always say, that things are common. Just because it's common doesn't mean it's normal. And peeing yourself is one of those. And like, you can go into even like feeling depressed after a baby. Sure, it's common, but that doesn't mean it's like in air quotes normal and expected. Absolutely. So I love that approach, because we do normalize these things. And like part of it is that moms and women and vulva owners don't prioritize themselves a lot of the time, because they're doing things for their family or for other people, or they're getting pulled in so many directions that they don't actually make themselves the priority. And it's important, because we deserve to enjoy sex and not be in pain and not pee ourselves. Yeah.
But I think that a lot of people do that. They're like, oh, if sex is painful, a lot of people just, okay, well, I just won't have sex. Because I've had all these experiences, I've, talked with a lot of people in the same community that have been going through the same things. And a lot of people just like, oh, we just haven't had sex for years. That's just fine. And yes, that can be fine, and that can be a decision you make, but you could also go and get some help and work on it so that you can enjoy that again, and you deserve to enjoy it. It's normalizing talking about it too, because people will just say, I don't want to go to the appointment. That's too scary to make an appointment and go see someone. Maybe they don't want an internal exam. That seems too invasive. I know for me, when I was like Googling things about this, it started talking about dilators and all these things. And I was like, oh, like this, oh, that's a lot. Like when you start, it can be overwhelming and scary. And I think society has kind of conditioned us to not talk about these things as much, and that we shouldn't be talking about sex, and we shouldn't be talking about putting dilators in our vaginas and how to do that's too
or even
personal.
Talking about enjoying sex, like that's still poo-pooed.
Yeah.
So for all the people who are overwhelmed by the idea of seeing a pelvic it's very hard, pelvic health therapist. Can you guys walk us through, like, what does a typical appointment look like an intake appointment and then the subsequent appointment? What can somebody expect?
Even before people come in the door, I think on our website, we have lots of descriptions about our therapists so that you can hopefully get matched with someone or choose a therapist that you feel is a good match for you based on personality, based on interest. We get people to fill a pretty comprehensive intake form just so that, we as the therapist have that good background knowledge. I think one thing I always let my clients know in that first appointment is that they have the choice on whether they want to have that internal assessment or not. While yes, the internal assessment oftentimes can be really helpful and give us a kind of a full view, but you guys said it's not everyone's favorite thing. Oftentimes it's scary and daunting, so they always have the choice. Typically, we'll do a lot of subjective, or we'll ask the client to tell us their story, to tell us, what brings them to Bump, just so we can get, again, that full picture and then use that to determine what kind of assessment we need to do to determine what kind of treatment then we kind of give them. I always like to leave my clients with at least one or two things that they can work on it themselves. Just to, one, empower them to be in charge of their own kind of health, in charge of their own recovery, but also so that we can begin that process towards feeling better, towards maybe not having any pain or being confident with their vulva or pelvis.
I love that.
And that initial appointment is also important. Like, what is important to this client that's really been brave to show up to this appointment today and talk about something that they maybe don't talk about with anybody else. Be really empowering to just, validate that person and their experience. And from a clinician side of things, like, I find that it's really meaningful to also recognize people when they've shown up for themselves, and just finding out what is important to them and what's really brought them in and what do they want to gain from coming to physio, because client-centered care really is an important pillar of healthcare, and sometimes I feel like that's not necessarily recognized enough.
I think it's also important for people to understand that, like, when you're going, you're seeing professionals. They're not going there and they're not going to look and feel around your vagina and be judging you and be like, oh, she shaves or doesn't shave, or, and it's always the joke that, like, you're going to go and take off your underwear, but everyone hides their underwear. It always still makes me laugh but you're going to see a professional. Like, they're not there to judge what you do or not do. Like, they are there to be there for you and support you, help you in whatever ways what you're looking for, and that it is a safe place. And I think that it's just important to kind of reiterate that this is a safe, professional place that you can go, and that there's not going to be any judgment and shame, and that they're there to help you. And I think that we just don't talk about that enough. It is a safe place to go to.
Yeah. And there's nothing to be embarrassed about if you're having any type of dysfunction or you're having painful sex. It's not something to be embarrassed about. It's not that there's anything wrong with you. It's just you need some help. Right?
And it's okay if you just want to go just so you can enjoy sex. Like, that's reason enough to go. Like, you don't need to have more reasons past that. If you're just like, hey, I actually want to enjoy this again, like, you go. Like, you do what you want to do. That's empowering. You should do that. Yeah, all the power to you. You don't need another reason. You don't need to, like, try to make it about something else so that you can be comfortable to go and make the appointments. Like, that's okay.
Yeah.
Totally. Yeah. I love what you said, that it's, like, a safe space for sure. And I think Meagan touched on this as well, that there's always an option about what to do or not to do. And I know all the clinicians at Bump, as well as pelvic health physios, consent is really important in our practice, that it really is about what is this person comfortable with, and, like, they're in the driver's seat when it comes to that. Like, an internal assessment isn't always needed. You've had it done in one appointment doesn't mean that's going to be what needs to happen every appointment. Like, each interaction is exactly isolated on its own. And it really is about just creating, like, a comfortable and safe space, because it really will help the person who's shown up today get the most out of coming.
Totally. Yeah.
Get the most out of coming.
Yeah.
Get it?
Yeah.
Sorry, I'm a 12-year-old.
Good catch.
Yeah. Can't slide that past me.
I think one thing I love about working in pelvic health is that lots of those type of sayings or jokes are so normalized, because we're hopefully also comfortable talking about, the pelvis and sex and things of that sort. So love it. And I'm here for it.
Yeah, perfect.
You guys made a reel and it had the like dilators in it, but I also think it had I think it's called the O nut.
Yeah, Ona, yep.
Is that? Yeah, okay. I'm like, it had that in it and it had something else. And I was like, yes, nowhere have I ever seen anyone talking about it, showing them. Really, it wasn't until I did this deep dive into what was going on with me and I was seeing all these specialists that they started talking about it, that I did some more research. But people just don't talk about these things. And the more it would like kind of come up, and I'm a very open person, so I would start talking about some of these things with my friends. Yeah, I can't use tampons anymore because I can't put one in. It hurts too bad. And I started kind of opening up this conversation, and so many people were like, oh, that's me too, but I've never told anyone that before. And so once I said it, they were like, okay, we can also talk about this. And then I found these few people that we all had very similar things going on, but none of us had talked to anyone else about it before. And it's interesting, like when you start that conversation, people kind of get more strength to get help themselves and to share, and it takes away that shame. So when I see you guys posting about this, it just makes me so happy because I feel like you're taking away that stigma. Like you're accepting like, yeah, you might need to use these things. Come talk to us. We'll help you. There's no shame in it. No judgment from us. We're safe. And that's what I get from your guys' account all the time. So I am very grateful for you guys, and it makes me feel happy when I see these things.
So for those of us who have no idea what Jen is talking about, I have a like sort of an idea. I've seen the eggs and the balls and all that, but so I don't know if we want to start with like the most basic, but what are some of the treatments you guys do? And then we can kind of get into all these doodads as well. I love it. I want to hear about them.
Do you want to give us maybe like something specific to talk about, like pain with sex, and then we'll talk about that? Or
yeah, let's do pain with sex.
Pain with sex can be because of multiple reasons. Dilators definitely are often a treatment that can be used. Not always the very first step because it can be a little bit intimidating to be like, a dilator essentially is something that would be inserted into the vagina to support somebody's ability to accommodate and accommodate without pain. But it can be for somebody who has a lot of pain with inserting something vaginally. This can be really intimidating, do not feel painful. So yes, that definitely can be part of treatment, but not always the initial treatment. For myself, I definitely would approach pain with sex with a lot of education about what happens to the body during sexual arousal, what happens to the pelvic floor muscles specifically, and what is their role in sexual function, and just how the pelvic floor muscles function generally. Yes, those muscles, like people probably know what Kegels are, like contracting the pelvic floor, but there's so much more to that function, which is really the other side of the spectrum, the ability to relax and lengthen the pelvic floor muscles. So usually a starting place is just like trying to connect with those muscles and understand what that feels like to relax and release tension in those muscles.
Okay.
And there can be a variety of exercises for that, but definitely some exercises would be part of treatment as well. I feel like that's always a good starting place.
Yeah. What does the dilator look like? Is it that it actually expands or like you increase the size over time?
Yeah, great question. There's typically multiple sizes of dilators. So the smallest size, at least the smallest size that we sell at the clinic, is something that's essentially smaller than the size of a finger, like almost the size of like your pinky finger. Somebody would progress through treatment if with dilators, they would size up and using something a little bit bigger, and then essentially getting to a size that would resemble a penis. So that is basically the progression of the use of dilators.
And do you put them in and keep them in, or do you just like put them in like when you're resting? Like how are they used?
There can be different approaches. Typically though, a dilator is inserted, and it's inserted in a way that's like comfortable. Might have a bit of discomfort, but not painful. Otherwise you are not using the right size dilator. Okay. But usually they are inserted to start. They can be used by applying like a gentle pressure from different angles and sides of the vagina, and then eventually progressing to being able to comfortably move that dilator in different positions, use it in different positions to resemble more so what sex would be like if you are thinking of penetrative intercourse.
Got it. Okay. And then what was the other thing that you said? The egg.
The O-nut. Nut. We're just going down a big rabbit hole.
Yeah, I'm just curious.
Yeah, we can talk about it. Yes, it has to do with painful penetration, like penetrative sex, depending on where your pain is, my understanding.
Mm-hmm.
So some people only have pain during intercourse when it's like further in the, I don't know how to say
like
these
deeper,
things properly.
deeper,
Deeper penetration.
Deeper penetration.
I'm like, I don't know how to say these things that
You're
sound
doing great.
professional with deeper penetration. And so the O-nut, you would basically, the guy would, I guess, put it on their penis and it would like
on the end.
Yes, on the end. So it would, they wouldn't be able to go in as far when you were having penetrative sex.
I see.
So then it would, right? And it would kind of, it would give them more of the feeling of going in further without it actually going in further for you, so that you're not in as much pain. If that's where you're in pain or discomfort.
I see.
Is my understanding.
Yeah, no, and that's totally it. It just basically shortens the length of whatever you are trying to insert. So it can also be inserted onto like a toy, or it can actually be inserted onto a dilator too to shorten that length.
Oh yeah.
I think the part of not hitting the spot that it hurts, I mean, that's one reason why, but I like to think that it also gives a little bit of that psychological or that mental comfort that I can have sex in the way I want to without being worried that my partner or the toy might hit that deeper spot that makes it hurt more. And so that you're hopefully less tense, less worried, and then hopefully in that way sex can become more pleasurable because there's less worry there.
Is it with deeper penetration when it's painful, is it usually that it's the cervix getting hit, or is it like parts of the muscles that are just deeper into the vagina?
It can be either or. Yeah, I've had clients who experience pain when the penis or the toy kind of hits the cervix, but then also individuals who have pain because certain muscles deeper in the pelvic floor are just more uncomfortable or are giving them that pain. So it could be both.
Yeah, so it could be either. And
I'm
guess
just going to add as well, our pelvic floor is like a highly innervated area by the nervous system. So it is just has this level of innervation from the brain and nerves that really can increase like those signals somebody feels. So that experience of pain or sensation can definitely be very different when it's related to pelvic pain than other areas of the body too.
Yeah.
It can almost be like a learned, I don't know if a learned behavior is the technical term, but because it can be so innervated that like you can get extra sensitive to touch is, again, my understanding from all my therapy. But yeah, you can kind of get oversensitized to things. So it's almost like there's almost like a whole mental mind-body connection when it comes to doing pelvic health therapy is what I've found. There has to be another component of adding in that mind-body connection. And because in order to release your pelvic floor, like you have to actually be thinking about it. There's an intention that you have to actually say that you want to do this. And the more positive experiences that you have, your brain will start to do that more automatically and quicker. And so I think that's also one of the things with dilators. Again, I'm not an expert. Is that if you can insert something and it doesn't hurt, and the more times that you do that, your brain is, okay, this is safe. And it kind of gives you that signal of this isn't so bad. And then when you go up in size, you have to train that mind-body connection and that nervous system response to what's going on. Because it can happen if someone was sexually assaulted. There's a whole other layer of your body wants to protect yourself from that assault, and there's that pelvic floor contraction that goes on, and then being able to release that if someone is intimate with you is very hard because of your trauma. So there's so many different layers to this. But I think the most important thing is that like we can have these conversations and we can talk about it. And if anyone is listening and you ever need to talk about these things, like I am always here for it, because I know how isolating it can feel when you don't know where to go, you don't know who to talk to about these things. Something feels different down there. I get some burning, I have this, or people get very closed off when it comes to anything pelvic health related. I find it's just really still stigmatized that you shouldn't be talking about these things, or you can't tell someone you're going to pelvic health therapy. Like, why would you tell someone that? That means you're talking about vaginas. Or newsflash, if you're pregnant, people know how you got pregnant. Like, it's, it's not a secret what you're doing. Yeah. Or if you're saying, oh, we're trying to have kids, like people know what that means. So you are talking about it.
But in a politically correct, like in a acceptable way. Yeah.
I'm very grateful that you guys are here talking about this, because I think we just need to talk about these more and have these conversations, and hopefully people listening will be like, we can talk about these things and it's okay. And Yeah.
And anybody listening, if Jen said you could talk to her, and please do, she's educated. She knows what she's talking
You're
about.
like a secret pelvic physio, I swear. I
Yeah.
cannot.
Yeah. So how about this? If people are listening from your perspective as professionals, although Jen, pretty much you are, but what would you say to somebody who's been thinking about coming to see a pelvic health therapist, but they either are, just brushing it off, that they don't feel it's important, or they're scared or embarrassed or whatever reason? What would you say to them?
Yeah, I would say it's like never too late to start talking about
good.
things. It's never too late to just get more education, get your questions answered. I would say if you're having some concern or you don't know, like just ask, because it's so okay to ask and just learn more. And those feelings of being scared or nervous are definitely valid. It can be scary to ask questions about yourself or your own body, or it's scary when you don't know the answers. So everybody's scared of the unknown. So that's like so valid. But just knowing that it's like people that work in this area of practice really do want to just support you on that journey. And it really is, I think, just generally the type of practitioner who works with this population is very non-judgmental, is very accepting and welcoming, and just knowing that it's like you're not the only one who wonders this or who's gone through this.
Yep.
And just even getting that experience of talking to somebody who can assure you that you're not the only person who's experienced this might make you feel a little bit more comfortable to make that second appointment or kind of do something you never really thought about.
Meagan, would you add anything to that?
Yeah, absolutely. Like, I think, you guys have touched on this quite a few times already, but the more we talk about these things within your friend groups, just in your circles, the less taboo it gets. And the amount of people I've had come in and be like, hey, I heard about you guys because my friend came to see you about X, Y, and Z. And then, more people are having that confidence to come in. And I love when I hear that, because it's just great, because a lot of people are having these pelvic issues but are too nervous to come in. So when it gets normalized, and I think the other thing I'll add is that you may not find that right match right away with that pelvic therapist, because it is such a vulnerable, such a kind of specific area to work on, that feel like you've connected. If you don't feel necessarily safe with the pelvic physio that you've started with, don't be afraid to try another one, because it's not always going to be a match on the first go. And hopefully you'll be able to find someone that can support you in the way you need.
Yeah, I like that, especially since one of you mentioned that you can, on the Bump website, you can read about the different therapists. You can kind of learn a little bit more about them and see if it would be a good match. And like you mentioned, Meagan, that it doesn't have to be an internal exam on the first appointment. You can also just go and get to know them, ask some questions, maybe even just ask, is this something you could help me with? What are the things we can do together? What can I expect? Because I think that could really help with people who are coming in with any type of like fear or embarrassment, or even if there is a history of any kind of assault as well, just making sure they can build that relationship and knowing that there is actually going to be proper consent. Because I know, like Alyssa, you said, oh, anybody working in this field, they want to help, which I love. But then on the other side of that, you would think the same with everybody working at the birthing space. But unfortunately, consent is like a really big issue in, labor and delivery. So a lot of people have trust issues. They're like, oh, well, I saw this OB, or I saw this family doctor who specializes in births, and they brushed me off, or they did an exam without proper consent, or, like those kinds of things. So it's hard for some people because they've had those experiences.
Definitely. That's so true. And thank you for bringing that up. I think particularly in that birthing space, sometimes it is just like a whirlwind of an experience, especially birthers don't always know what's happening to their bodies or what's going on. And I think that's even, you asked a question previously about what somebody can expect, and like in coming to pelvic floor physio and coming to address the pelvic floor, if people are postpartum or have a history of childbirth, like often discussing that birth story to really understand like what was their experience? How did they feel about that? How are they doing since that is an important piece at getting to know and providing care to the person in our treatment space.
Just wanted to highlight like another option for people, because we did touch on quite a bit that, you know, the internal is not mandatory. And a lot of clients I see, we've never done an internal because that's not something they're okay with. And that's totally okay. We'll do lots of external treatments or assessments. We also have something called a real-time ultrasound. And so we can externally then take a look at what your pelvic floor is doing and you know, use that to create that treatment plan. And that works really well for someone that might not be okay with the internal assessment.
That's a really good point. And like you said, it's like a full body experience. Like your pelvic floor is not isolated from everything else. And based on some of the exercises, it sounds like Jen is doing, like it's a lot more than just internal work. Like it's actually
it's a lot more than just doing Kegels. And I think people are like, oh, I have incontinence problems, I'm just going to do Kegels. Like that's what everyone talks about. And I think people just get very focused on the
strengthening, but sometimes it's
the strengthening, but like the shortening of the muscles and the contracting, but no one focuses on, like you said, the lengthening and releasing that you actually need to be able to do as well. And I think we talk about the incontinence part is more normalized. Like everyone laughs, haha, you're gonna pee yourself when you're skipping, but like you don't need to pee yourself when you're skipping, right? There's things that you can do. But I was going to say the ultrasound is actually really cool that I found, again, for that mind-body connection. They did that in my first appointment, and me being able to see my pelvic floor move when I did certain things, just for me to feel it, but then see it, there was like a connection that was made that I could understand my body. And I felt more in tune with my body after seeing the ultrasound. And in my first appointment, that's all we did. Like I saw the ultrasound, but I felt like I got more insight into my body than I knew before. And that was without doing any internal exam. So I really like that you highlight that there's lots of things that you can do that doesn't have to feel invasive if that's not comfortable. You can go at your own pace. Like you control the pace of your treatment. It's not controlled by the practitioner. Like they're going to help you along, but that ultimately, if you don't want to do an internal exam, or if you can only do a partial internal exam and only do it for a couple minutes, like it doesn't have to be a half an hour internal exam where you're stretching the muscles and doing all of these things. It can be something, you know, you can go baby steps and take it slow, and that, you can feel in control, I guess is my point.
Mic drop.
That's a great point.
Yeah.
Just silent.
It's interesting to me because after you have kids, I think a lot more people are very open about things. And I don't know if you guys have experienced this when you see people coming to see you, but the women I know that have had kids, a lot more people are like, oh, breastfeeding, like boobs out. Oh yeah, I went, at the hospital, you're getting lots of exams done. Lots of people are there. I find more people get more comfortable with their body after having kids than before. And I know that was my experience.
But they could also maybe feel more embarrassed about things too if they've never had any dysfunction and everything for them has been like air quotes normal, and then they have a baby and for the first time they're having some sort of dysfunction, or maybe they have a prolapse, or they feel like something is wrong but they've never had that. So then maybe to them they just like zip up and don't, know? Like
I
think
was a point I was going to make and I don't remember what I was making.
It's definitely more normalized during the pregnancy perinatal world to talk about this, but I think also we surround ourselves with a lot of people who are like, hey, tell me about your vagina, but not everybody has that level of friendship, right?
Yes,
that is we're true. Just special.
We are special.
Note, actually, that brings up something I thought of. I think postpartum, when I ask folks, are you okay with the internal, a lot of people are like, oh yeah, everyone and their dog has been up in my vagina, so good. And I mean, I love when people are confident about it, but also know that you can still have that autonomy over your own body and have the chance to say no. Just because you've had that baby and everyone's been up there doesn't mean then now everyone has to be up there and it's okay.
Yeah.
I love that. Just because a couple people have doesn't mean you need to keep saying yes.
Just because you had a baby come out of you with 20 people in the room and a spotlight on you doesn't mean that it's just you've lost all autonomy and having control of who can see it and touch it. And that's good, because I think sometimes in childbirth and just in moms, we kind of lose our own sense of just ourselves. Like we do become more free in a way, but like when you're breastfeeding, your breasts really aren't yours anymore. They're your baby's. So it's kind of like bringing that back. Like, these are my goodies. My goodies. My goodies. I got music stuck in my head. Well, fam, that's all we got for today. Tune in to next episode to hear the rest from the Bump Pelvic Health therapists, Alyssa and Meagan. Bye now.